Spirituality is going to be our last concept. So please make sure that you do go through and review the PowerPoint slide from your fundamentals textbook and look at the notes. Also, too, please make sure that you listen to this video and review your concept, and we'll be ready to go for class when I return. Here are a few things that you want to look out for in this concept. Also, too, please make sure that you pay attention about nursing care and how nurses' roles are represented in the chapter on spirituality and things that we look after. So please don't take it for granted that this is an easy concept and that you'll be able just to answer the questions when you see them. Please pay close attention. It can be confusing at times because really a lot of times people think about spirituality as a religion, and actually it's something beyond that. It's something that gives people that get up and go, something that may be a bit different for each person. So some of the things we want to remember is that spirituality can be a combination or bits and pieces of our spirit, our body, and our mind, and is putting them all together. It may be something that someone feels very powerful, some kind of source. And many times we want to think everyone thinks the same as we do, but it goes beyond that. So someone can be spiritual, but yet not practice a religion. So when someone is asked on a history, they may say, I don't practice religion, but I'm a very spiritual person. And again, someone can be spiritual and not practice a religion. Here's some definitions, and I highly recommend that you do go back and review some of the definitions and what they mean in your chapter. Some of the other definitions you may also see is atheist, and this is someone who does not believe in the existence of God. We may even see individuals who say, I'm agnostic, and this means they don't believe in ultimate reality, but they have spirituality regardless of religious beliefs. They discover meaning in what they do and how they live instead of towards a religious belief. So they believe that there's no ultimate meaning for the way things are. They feel like things are by the way they live their life. Also, too, with faith, and faith is believing in something. So you can't see it, or someone may believe in it despite any physical evidence. An example is those who are of the Christian faith believe in heaven and believe there is a heaven. Now, someone can say, well, you've never seen it, but they have that faith that is there, and that's where they go, or the spirit goes after someone has passed. Here's some other key terms that you'll want to look at as you're studying and reviewing. And again, remembering that religion is different than spirituality and spirit, and we can give different types of care. So we can give religious care, where we help people maintain their faith, their faithfulness to their belief system and their practices that they do for worship. Ash Wednesday, it may be prayer, it may be prayer time where they get down on the floor and we assist them to have their prayers, or they may do certain incense or clang bells, but different things that they do, and so we do help them. When we give spiritual care, some of the things we want to think about is helping people to identify a meaning and a purpose to their life, helping them to look beyond what is now and maintain personal relations with others, even a relationship with some type of higher life force or higher being that's greater than them. Spirituality is very important when we see this in patients who have very difficult diagnosis and a poor prognosis. And giving them this spiritual care can help them to move forward and help them to get through some very difficult times. Here we see a scope of the concept. So someone can have day to day their good spiritual self, and then they may, if they fall below that and they do not have that hope and their spirituality starts to fail them, we'll see more of sorrow and despair. On the other end, on the opposite end of the spectrum, you see the soaring spirit. Spiritual health does represent a balance. And again, as we mature, we see an increasing awareness of people trying to keep that balance. And I think a lot of it has to do with people's values and their life values. And we definitely grow in our spirituality as we grow and as we develop. And I believe also too, the more life experiences we have. When we think about spirituality, here's some common attributes. And I think these are very important pieces to understand. We want to know how strong people are in their spirituality. And so we will do a spiritual assessment. And usually lots of times this is just by talking to your patient and or their families about their thoughts about their illness and coming up with a diagnosis and realizing that each person has a unique spirituality, and at times it can be broken and or it's faltering or it's going on the one end of the scales, and we try to help them keep that balance. When someone can't keep that balance, they may see conflicts in their beliefs. And so we may use resources such as clergy or spiritual advisors if someone's having spiritual distress. And this is that the inability to experience and integrate meaning and purpose of their life through connecting either with themselves or with others, or through something that usually gave them peace and uplifted them. Sometimes we will see this in the spiritual distress where they don't want to be around their friends, their families. They kind of cut everyone off. In class, we're going to actually go through a FICA tool. So I do have you bringing that. So please make sure that you do print that FICA tool, and we'll bring that in. And again, it looks at faith, importance, community, and dress. And it's looking about what is their faith or their beliefs, the importance or influence it has on their life, what community areas, how do you celebrate this, or how do you go day to day within the community, where do you go to get this, and then address what can I do for you to help support their spirituality. So we're going to look at this in class and go over it. And as we go over it, we're going to evaluate spirituality, because that's what this tool does. Evaluates spirituality and is going to correlate the quality of life for a patient. We do have different theories of spirituality, and one of the things that we do in our nursing process is we want to assess and ask individuals about their guidance, their source of their guidance, whether it's religious or spiritual, and understand their philosophy of life. And you'll hear many different types, and sometimes you may go against your beliefs. But again, we do not use judgment. We want to help them to assess assess them for anxieties and how they may influence their religious beliefs, or even the nurse may influence a patient's abilities to function and help them to achieve their goals. As a nurse, I want to be able to come up with a plan to help my patient include those realistic and individualized goals around their spirituality. I want them to identify what is the most important thing to them and find some type of care for them. Even your pastors in the hospital can be a very valuable resource for our patients. When our patients are suffering from spiritual distress, we can teach them things such as meditation, relaxation, guided imagery. We can help them to come up with activities that can help them to heal their body, their mind, and their spirit. And we can offer prayer. Or they may want to go somewhere alone and pray or meditate. So it depends on their beliefs and their spirituality, but we want to help them to get back to that point to where they can have hope and not everything is just given up and I'm going to just not do anything anymore. Their spirituality can be a comfort and it can help them through the process. Here I want to go over a few things too when we think about our nursing and what we do. Even if you have the same beliefs, it's important that you don't impose your personal values and beliefs on that patient. It's easy to make false assumptions. So again, even if you have the same beliefs and affiliations, don't impose your own personal values and beliefs on them and assume that they have the same ones, because there you can make a false assumption. And a few other things that you want to make sure that we talk to them about is diet. You may have a Jewish or someone who practices the Judaism religious and beliefs, and so they may need kosher foods. For your Islam patients, remember no beef, pork, or alcohol. So you want to look at their diet trays and what we can offer for them as far as diet therapies. Offering prayer and helping them to restore their spirituality and their is allowing them times. If it's a Hindu patient, we may want to give them some place to practice their purity rituals and prayer. The Islam have the 5 pillars. Your Christians may want Holy Communion. Navajo Indians believe in what they call blessing ways, which is stories, symbols, and rituals. So you may ask them if there's something they want to bring in or have family bring in from home. Jehovah's Witness, again, remembering, to respect their decisions, especially it has something to do with blood products. If I want to evaluate how well my patient is doing in that nursing process, I want to talk with the family and friends about the patient's connectedness. Are they feeling connected, or is there still a disconnect? Did we meet expectations? Did we meet theirs? Did we meet the patient's expectations? We want them to be able to go back through and review their purpose in life. That definitely shows that there is some healing. Review their self-perception. How do they perceive themselves, especially regarding their spiritual health? Do they feel like they have found their way back onto their path? This last slide actually just shows you a little bit about the concepts and how they interrelate. And again, when we think about spirituality, we want to think about also in combination how culture is a part of that, as well as family dynamics. And then a couple of other concepts that can actually be integrated in there is development and cognition. Where are they in their development, their growth and development? How much do they understand? And then also communication, being able to communicate with them and also communicating with professionals as far as even reaching out to their spirit guides, to the hospital chaplains, to physicians and doctors, and helping them to understand their spiritual beliefs and making sure that we do make that a strong point in their care. If someone doesn't have hope and have that spiritual guidance that they need, whether that is a greater life source, such as God or spirits or a way of life, they need that to move forward, to give them hope. When the patient is in despair, we've lost many patients who give up. And I know you've heard that many times when we tell patients not to give up, to keep going, to keep going. And we have had many that have fought through. So please take your time and make sure that you do review your NCO notes and the textbooks, and review the PowerPoints and any links. And when we have class, we'll go over some assignments that I have for us to do. And I am changing. Hopefully you're all listening to this, but I am changing because I cannot find the NCO case studies anymore. For some reason, they have disappeared, and we have been in contact with the book company, and I still don't have them, so I will probably have a different assignment waiting for you. So please pay close attention, and I will see you in a week.